This video provides a comprehensive guide for the PTCE 2026 exam on anti-cancer drugs. Proactive patient education is key, with immediate reporting of severe symptoms like fever or uncontrolled vomiting/diarrhea being critical for emergencies. Common side effects include myelosuppression, nausea and vomiting, alopecia, mucositis, diarrhea, and peripheral neuropathy, each requiring specific management strategies. Let's review some practice questions on mechanisms of action. Taxanes stabilize microtubules. Methotrexate inhibits dihydrofolate reductase. Doxorubicin is an anthracycline antibiotic and topoisomerase II inhibitor. Cyclophosphamide and cisplatin work by alkylating DNA. Imatinib targets the BCR-ABL fusion protein. Look for keywords like stabilizing, inhibiting, or suffixes like tinib and rubicin to identify drug classes. Drug interactions are critical. Grapefruit juice inhibits CYP3A4, increasing nilotinib levels. Warfarin and capecitabine increase bleeding risk. Live vaccines are contraindicated with chemotherapy due to immunosuppression. Leucovorin rescue is essential after high-dose methotrexate. Lastly, cisplatin and aminoglycosides have additive nephrotoxicity. Here are common PTCE calculations. Be prepared for body surface area or BSA and dose calculations, creatinine clearance, drug volume calculations, and carboplatin dosing using the Calvert formula. Always double-check units and remember common constants for the exam. Safety and regulations are important. Hazardous drug compounding should occur in a negative pressure room. Always use double chemotherapy gloves and eye protection. Dextrazoxane is the antidote for anthracycline extravasation. Recognize pregnancy contraindication Category X drugs like methotrexate. Immediate action for suspected extravasation is to stop the infusion and leave the catheter in place. Identifying trick questions is key to success. Watch for brand and generic confusion. Be alert for mechanism reversals. Recognize interaction clues, such as 450 cypriot pounds inducers or inhibitors. In calculations, focus on necessary information and ignore distractions. Finally, prioritize immediate safety concerns in patient scenarios. Time management strategies are vital for the exam. Pace and flag difficult questions. Save calculation questions for the end to avoid getting stuck. Use the process of elimination. Trust your first instincts as they are usually correct. Finally, utilize the entire 2-hour period to review flagged questions. Use memory aids and mnemonics. MVP stands for mitomycin, vincristine, and platinum drugs, all of which are vesicant. Taxi helps recall Taxenis. Folk identifies folate antagonists like methotrexate, which need leucovorin rescue. Learn to identify drug types by suffix, such as, quote, MAB for monoclonal antibodies, and NIB for tyrosine kinase inhibitors. COLD is a mnemonic for extravasation management. Anti-cancer drugs are high-alert medications and require special handling. This list includes methotrexate, cisplatin, carboplatin, doxorubicin, cyclophosphamide, and paclitaxel. Error prevention strategies include double checks, barcode verification, standardized protocols, and enhanced monitoring. Be mindful of look-alike and sound-alike pairs. Sterile compounding of chemotherapy requires careful attention to USP requirements. This includes negative pressure environments and BSCs, CSTD implementation, and specific decontamination procedures. Dose verification requires pharmacist double checks and independent calculation verification. Documentation includes lot numbers, personnel identification, and environmental monitoring. Review BSA and dose calculations step by step. Know the Mosteller formulas for both metric and imperial units. The steps include converting weight and height, calculating BSA, and then calculating the ordered dose. Key considerations include renal adjustment using Cockcroft-Gault and verifying all calculations. Emerging therapies include immunotherapy checkpoint inhibitors like pembrolizumab, CAR T-cell therapy, and antibody-drug conjugates. Also, be aware of PARP inhibitors like olaparib, which block DNA repair enzymes, specifically in BRCA-mutated cancers. For a final review, remember the must-know drug classes and their mechanisms. Be aware of critical interactions, such as grapefruit juice and live vaccines. Practice high-frequency pairs like vesicants and brand/generic pairs to build confidence for exam day. Stay calm and focused. Here are some resources for continued learning. Recommended references include the NIH list of hazardous drugs and ISMP high alert medications. Utilize online resources like the PTCE website and NCCN guidelines. Professional development options include ONS certifications and PTCE hazardous drug management certificates. Stay current by regularly reviewing new drug approvals. You are ready for exam day. Complete your study by mastering drug classifications, mechanisms, interactions, calculations, and USP less than 800 greater than requirements. Prepare by arriving early, bringing ID, and managing time. Success indicators include identifying drug classes, recognizing interaction patterns, and understanding safety protocols. Trust in your preparation. Good luck on the exam.